My name's Emma Morris and I'm a consultant clinical psychologist here at the Anna Freud National Centre for Children and Families, where I work mainly with families and young people involved in care proceedings or post-adoption, or those families where there's parental separation and a lot of conflict between the parents and they're involved in court. A referral is basically a request to access a service or support. It can be made from another professional, it can be made, you can get a self-referral, but it is usually a written request to access a particular service. That's a really difficult question to answer because it kind of depends on what service you're being referred to. Some services are there to kind of get in and help early on. Other services are there for more like crisis points in your life. I think probably a better question to ask yourself is, do I need help? Do I feel like I need help? Do I feel like I'm not managing day to day? Am I not doing the things that other young people my age are doing or that I used to be able to do? Do I feel like I need help in order to be able to cope better day to day and in order to be doing the sort of stuff I want to be doing day to day? Again, that kind of depends on where you're being referred to. If we think about CAM services, it depends where you live in the country as to who can make a referral. So there are definitely some places in the country where only GPs can refer into CAMs. There are other places where schools can refer to CAMs, and there are even some places where CAMs do accept self-referrals. So you need to do some research and find out what the situation is in your area. Your GP and your school will pretty much always know how to best access CAMs. But there might be other services as well apart from CAMs that you want to access. There are kind of various voluntary services, charity-based services, and there's also private therapists, private providers, and they have slightly different referral routes. Again, I'd probably advise going to your GP and talking to them about what resources are available in your area, or maybe if you feel kind of safe to ask school if they know what provisions are out there for young people and how you get into them. The reality is, I think, most places in the country that there is some limits on the number of different services that you can access. And there are some pressures on services, especially CAMs, in terms of the amount that they can offer people in that area. So there are some services that you may be eligible for. So it would be great if we could think about all the different services that are in our area and choose which one do we want to go for. But the reality is that sometimes you can't access the services that you would like to. But that's not to say that it's not a good idea to do a bit of research about what's available in your area and how to be referred into those different services. But it's also good to take advice because people will have understanding, maybe a better understanding of those different services than you do, maybe just by looking at the website or hearing just one person's account of it. So, for example, your GP might have a good idea about why it's better for you to go to this service rather than that service, and you can have that discussion with them, and then you're making more of an informed decision if you're lucky enough to be in a position where you can decide which service you want to go to. So again, it kind of depends on where you're being referred to and who's referring you. But if we think specifically about CAMS referral, because I guess that's the kind of most obvious type of referral that young people will get if they're worrying about, if they need help with their mental health. Your GP usually, that can be your school in some areas, will write to CAMS with a brief description about why you've come and why you need help. And then the CAMS team will take that referral into their meeting and allocate you an appointment for an assessment. That assessment can be anywhere between 1 or 3 sessions normally. And you'll be invited to go and meet with a therapist and talk about kind of what's brought you to CAMS. If you're a bit older, certainly if you're over 16, you can go to your GP and seek a referral without your parents' consent. And once you've been seen for that assessment, you will then hear back from the CAMS service, and they will let you know a little bit about how they see the problems and what support they might or might not be able to offer you. And at that stage, the stage of your assessment, it's quite important for you to think yourself about what sort of help you want, because quite often young people have been struggling for a little while before they actually get to the GP and ask to go to CAMS. So you might have done a bit of thinking about, if you had therapy, what sort of therapy would you like? Maybe you've done a bit of research about different types of therapies, or for some reason for you it's really important that, for example, you see a woman rather than a man, and at the assessment you can tell them those sorts of things. They're not necessarily guaranteed to provide you with exactly what you want, but they will bear in mind that sort of feedback from you. Well, again, this can depend on where you live in the country, because different CAMS services have different waiting lists. It's quite common to not have to wait so long for an assessment, but then to have to wait a little bit longer before you can actually start the therapy. And the wait can be anything from a few months to sort of 10 months in some places. I guess the important thing is that while you're waiting for help, you try and think about what support you can put in place while you're waiting. Whether that's, there's a lot of self-help resources available. There are some on this website. Your school will know a lot of self-help resources that you might be able to access. They might be able to offer you some counselling or some private space in the meantime. Peer support, where you can talk to your friends or join groups, people going through similar things. It's important not to just sit and wait and think to yourself, right, okay, I've sorted out the help, now I just need to wait until I get there. You need to kind of build up the support around you while you're waiting. And I would say what is really, really important, I just can't recommend can't advise strongly enough, is to make sure that there's at least one other trusted adult that kind of knows what's going on for you, that you can check in with, that will know if things start to get worse, and that can help you if things start to get worse. And if things do start to get worse, then it's important you go back to your GP, because if problems get more severe, then sometimes that can affect the length of time you have to wait to access the services. If you hit crisis point while you're waiting, if you start to feel so bad, you're worried about harming yourself, you literally can't cope, your day-to-day life is falling apart, then it's important you access urgent help. You can do that through calling helplines, going to a GP, going to A&E. Hopefully you'll have a trusted adult who can help you with that. And on this website, there's an urgent help button that can provide you with all the details and contact information around accessing urgent help. I guess the reason that a professional might make a referral is because they think that you need help, and they have an idea that a service might be able to provide the sort of help that you need. So I guess if you are worried about a referral, if you're worried about you don't want to access a particular service for a particular reason, it might be useful to have that conversation in an open way with the person making your referral. Sometimes that can be really hard because, with adults, you can feel like they can be hard to disagree with, because if you're a young person and they're an adult and they're like a professional GP, it's like quite hard to say, I don't agree with you. So maybe if you're thinking like that, bring somebody with you. to the appointment who might help you be able to speak your mind. But the other thing I would say is, don't decide until you've tried coming to a service, because people might have had a bad experience and you might have completely different experience. Not all CAM services are the same, not all therapists are the same, and I've certainly met loads of young people who come along to the first appointment and they don't want to come, and their parents have dragged them along, and they after a few sessions they've said, this isn't what I expected it to be, and they've been pleasantly surprised. So it's not, if you want to make a decision about what's best for you, it's important for you to make sure you've got all the information. And part of that information is about coming along and trying for yourself.